Singapore authorities are in touch with their counterparts in Japan to get more information on COVID-19 reinfection. The consultation follows reports a Japanese woman has tested positive for the virus for a second time, weeks after she was discharged from hospital.
But the Singapore Health Ministry says it's still too early to make any definitive conclusions about reinfection. Cheryl Go with more.
You would have heard that Japan has confirmed its first case of reinfection after a woman in her 40s got the virus again. This comes on the back of other instances of reinfection from China. The Health Ministry said it is in touch with its counterparts in Japan to find out more about the case, but said that it cannot make any definitive conclusions on reinfection at this point. What we know so far is that MOH said the human body may develop an immunity response to any type of virus, and hypothetically the risk of reinfection is extremely low. But again, this is not a given, as it would depend on the immunity of the individual patient. No specific conclusions can be drawn at this point, given the limited though growing understanding of the virus. In the meantime, MOH says it's taken extremely stringent procedures to make sure that recovered patients here are clear of the virus when they are discharged. They go through rigorous testing and have to test negative for the virus twice, 24 hours apart. On top of this, they may undergo various swab tests depending on the individual patient. MOH said this could range from saliva to nasal discharge to even urine. There's even a case where a mother's breast milk was tested to ensure she was completely virus-free. Of course, they must also be clinically well, so this means they mustn't show any symptoms. After discharge, they will be given a period of medical leave, where they'll be advised to stay home and avoid crowded areas. They will also need to return to the hospital for follow-up checks.